we're lifting off. Nothing holds us bound. Can you see it? The light of Africa is rising to higher grounds. We're lifting off. Nothing holds us bound. So come on and come on. We call on, oh Africa, come let us build a dream for all. Together we grow stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines that separate, and shine the light on the things that make us great. We're stepping forward, we're rising up. Oh Africa, our time is now. Oh, 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 yeah. We know we got that power. Africa, we are strong. One nation to another. See now we stand as one to celebrate our victory. Riches and glory of the motherland, and nothing holds us bound. So come on and come on. We call on, oh Africa, come let us build a dream for stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines that separate, and shine the light on the things that make us great. We're stepping forward, we're rising up. Oh Africa, our time is now. Oh, 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 Africa. Oh, 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 it's a new day. It's a new beginning. Higher ground, we're lifting up, and nothing holds us bound. It's a new day. It's a new beginning. Higher grounds, we're lifting off. Nothing holds us bound. Can you see it? The light of Africa is rising to higher grounds. We're lifting off. Nothing holds us bound. So come on and come on. We call on, oh Africa, come let us build a dream for all. Together we grow stronger and united. Paint out the sky with the bright bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh, Africa, our time is now. Break down the chains, clear the lines that separate, and shine a light on the things that make us great. We're stepping forward, we're rising up. Oh, Africa, our time is now. Oh, 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 yeah. We know we got that power. Africa, we are strong. One nation to another. See now we stand as one to celebrate our victory, riches and glory of the motherland. And nothing holds us bound. So come one and come all. We call on, oh Africa, come let us build a dream for stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh, Africa, our time is now. Break down the chains, clear the lines that separate, and shine a light on the things that make us great. We're stepping forward, we're rising up. Oh, Africa, our time is now. Oh, 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 Africa. Oh, 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 it's a new day. It's a new beginning. Higher ground, we're lifting up, and nothing holds us bound. It's a new day. It's a new beginning. Higher grounds, we're lifting up. Nothing holds us bound. Can you see it? The light of Africa is rising to higher grounds. We're lifting up. Nothing holds us bound. So come on and come all. We call on, oh Africa, come let us build a dream for all. Together we grow stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines that separate, and shine a light on the things that make us great. We're stepping forward, we're rising up. Oh Africa, our time is now. Oh, 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 yeah. got that power. Africa, we are strong. One nation to another. See now we stand as one to celebrate our victory, riches and glory of the motherland. And nothing holds us bound. So come one and come all. We call on, oh Africa, come let us build a dream for all. Forever we grow stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines that separate, and shine the light on the things that make us great. We're stepping forward, we're rising up. Oh Africa, our time is now. Oh, 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 Africa. Oh, 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 it's a new day. It's a new beginning. Higher ground, we're lifting up, and nothing holds us bound. It's a new day. It's a new beginning. Higher grounds, we're lifting up. Nothing holds us bound. Can you see it? The light of Africa is rising to higher grounds. We're lifting up. Nothing holds us bound. So come one and come all. We call on, oh Africa, come let us build a dream for all. Together we grow stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines that separate, and shine the light on the things that make us great. We're stepping forward, we're rising up. Oh Africa, our time is now. Oh, 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 yeah. We know we got that power. Africa, we are strong. One nation to another. See now we stand as one to celebrate our victory, riches and glory of the motherland. And nothing holds us bound. So come one and come all. We call on, oh Africa, come let us build a dream for all. Forever we grow stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward. We're rising up. Oh, Africa, our time is now. Break down the chains, clear the lines that separate, and shine the light on the things that make us great. We're stepping forward. We're rising up. Oh, Africa, our time is now. Oh, 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 Africa. Oh, 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 it's a new day. It's a new beginning. Higher ground, we're lifting up, and nothing holds us back. It's a new day. It's a new beginning. Higher grounds, we're lifting off. Nothing holds us bound. Can you see it? The light of Africa is rising to higher grounds. We're lifting off. Nothing holds us bound. So come on and come on. We call on, oh Africa, come let us build a dream for all. Together we grow stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines that separate, and shine a light on the things that make us great. We're stepping forward, we're rising up. Oh Africa, our time is now. Oh, 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 yeah. We know we got that power. Africa, we are strong. One nation to another. See now we stand as one to celebrate our victory, riches and glory of the motherland. And nothing holds us bound. So come on and come on. We call on, oh Africa, come let us build a dream for stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines that separate, and shine the light on the things that make us great. We're stepping forward, we're rising up. Oh Africa, our time is now. Oh, 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 Africa. Oh, 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 It's a new beginning, higher ground, we're lifting up, and nothing holds us bound. It's a new day, it's a new beginning, higher grounds, we're lifting up, nothing holds us bound. Can you see it? The light of Africa is rising to higher grounds, we're lifting up, nothing holds us bound. So come on and come on, we call on, oh Africa, come let us build a dream for all. Together we grow stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines that separate, and shine a light on the things that make us great. We're stepping forward, we're rising up. Oh Africa, our time is now. Oh, 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 yeah. We know we got that power. Africa, we are strong. One nation to another. See now we stand as one to celebrate our victory, riches and glory of the motherland. And nothing holds us bound. So come on and come on, we call on, oh Africa, come let us build a dream for stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines that separate, and shine a light on the things that make us great. We're stepping forward, we're rising up. Oh Africa, our time is now. Oh, 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 Africa. Oh, 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 it's a new day, it's a new beginning, higher ground, we're lifting up, and nothing holds us bound. It's a new day, it's a new beginning, higher grounds, we're lifting up, nothing holds us bound. Can you see it? The light of Africa is rising to higher grounds, we're lifting up, nothing holds us bound. So come one and come all, we call on, oh Africa, come let us build a dream for all. Together we grow stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines that separate, and shine a light on the things that make us great. We're stepping forward, we're rising up. Oh Africa, our time is now. Oh, 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 yeah. We know we got that power. Africa, we are strong. One nation to another. See now we stand as one to celebrate our victory. Riches and glory of the motherland, and nothing holds us bound. So come one and come all, we call on, oh Africa, come let us build a dream for stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines that separate, and shine a light on the things that make us great. We're stepping forward, we're rising up. Oh Africa, our time is now. Oh, 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 Africa. Oh, 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 it's a new day. It's a new beginning. Higher ground, we're lifting up, and nothing holds us back. It's a new day. It's a new beginning. Higher grounds, we're lifting up. Nothing holds us bound. Can you see it? The light of Africa is rising to higher grounds. We're lifting up. Nothing.
All right. Good afternoon, ladies and gentlemen. No. Come on. Have you not eaten? You know, it's an African thing. When we don't eat, our voices are relatively low. Good afternoon, ladies and gentlemen. All right. That's the kind of excitement that I'm looking forward to seeing today. How is everybody feeling? No, see, you got to help me out. How's everybody feeling? See, your response determines the amount of confidence that you have. And I can tell for a fact that Africans are very confident people. Everywhere we go in the world, we exude confidence. So can we show that we are Africans? When I say we're Africans, I'm supposed to say, but I was kidding. Anyways, how's everybody feeling right now? Feeling great. All right, awesome. So we're going to be starting in a few minutes. I know you guys have been working hard on your pitches and your products and your solutions. The time is now. I have a very, very good idea how a lot of you are feeling because I've been on that side of the table more times than I care to count and mention. Let me introduce myself. My name is Sydney. Let me start again. My name is Dr. Sydney Esiri. A lot of people in my country back home in Nigeria and in some parts of the world that listen to Afrobeats know me as Dr. Sid. I'm a qualified dentist, turned musician, turned filmmaker, current gamer, and serial entrepreneur. So I understand how it feels to come up with an idea or a solution to a problem and try to get someone else to believe in it and develop it with you and scale it up. So I'm going to tell you guys today, you are in the right place, you have done the right amount of work, and it's time for you to show what you can do. Don't be nervous. Just believe in yourself, and we're going to get through this. I'm not going to be doing this alone. I have this beautiful woman next to me. Her name is Kachi. Ofia Kachi, would you introduce yourself?
Hello, everyone. I'm really excited about this. My name is Kachi Ofia. I'll be your co-moderator today. I'm really happy because healthcare is such an important part of our world. As a matter of fact, my mother would always say, treat your body right and it will thank you for it later. Your health is your wealth. So I think you've said everything that needs to be said. Are the pitches here? Are we feeling good already? I need to feel that energy, pitches.
He's a little too excited. He's been excited for the last 5 days, following me around. I see you.
Okay, so let's do this. Let's do this instead. If you hear your name, that if you hear your team name, because they're brands, we need to kind of know who is who. Just, represent. You can get up, you can scream, you can raise your hand, you can clap, you can nod if you're not in the mood. We'll just take it however we do. So first things first, we have Team Safe Access. Okay, guys, come on, support them.
He brought an audience. Organo Munion.
Okay,
so I'm going to scream for you. Woo!
Listen, you can break dance if you would like. Like, whatever makes you feel good, it's okay. The third team is Mina.
See,
Mina is all the way at the
Mina
back.
is too cool for school. They're like, hey. we out here. We don't scream too much, but we out here.
This is healthcare, right? So you never know. You cannot judge a book by its cover, so I guess we'll have to wait to see.
And we have Amira Fertility. See, I believe in you. I don't know what you have, but you see the way you screamed just now. That's the kind of energy I'm looking for.
All right, let's go Metrace Africa. Okay.
See, gentlemen, listen.
They did stand up.
No, hold on a second. Gentlemen, you have to support the lady. The lady can't be the only one who in the place. So she goes, whoo, you go, yeah. You know what I'm saying? You got to show, yeah. You got to put some power behind it. You know what I'm saying? All right, let's do one more time. Let's go.
I'm just going to act like I haven't called your name before. So let's reverse. So we have Metrace Africa.
That's what I'm talking. Much better. We're going to work on that.
And finally, the last but not the least, InfoCare. InfoCare? Okay, I guess an InfoCare is on its way. They will be here. We can still give a round of applause for them. Yes,
I'm going to take it for InfoCare.
Okay, so now that we know the teams, of course, we'd like to introduce you to the judges. But before we do, a bit of housekeeping before we start. First things first, we're going to begin with the opening remarks, and then the pitches will begin. We will give you the information about how much time you have, which I'm sure you are already aware of. But for now, let's have you meet your esteemed judges. Dr. Sid? What?
Why you doing that? Why you calling me? I'm unavailable. My name is not Davido.
Okay, so we're going to begin with the Chief Executive Officer, African Medical Center of Excellence in Abuja, Mr. Brian Deaver. A round of applause for Mr. Brian Deaver. Thank you so much for being here today. We're so happy to have you. We're honored. And of course, we have Dr. Adedolapo Fasawe, the Mandate Secretary, Health Services and Environment Secretariat. A round of applause. I mean,
no, you gotta say it right. You gotta say
alias?
it's DDF. We gotta say DDF.
I was going to say
DDF. DDF is where it's at. You know, I'm your supporting striker on this one. I'll tell you that. DDF.
Well, yes. So we have two more judges that will be on the same panel today. But just before we introduce them, I think it's also very, very pertinent for us to do, you know, a brief understanding of why this is so important. Dr. Sid spoke about how he is a medical doctor and an entertainer at the same time. Now, Sid, I can't imagine merging both worlds. What would you say is the one unifying factor for both industries?
I think passion. I think a lot of people underestimate the meaning and strength of passion, believing in what you do and doing it even when there is no clear sight of revenue is a key driver in showing how much effort and energy you put behind a project. So passion, I would say, is one of the most important qualities that cuts across every single industry, from entertainment to healthcare to movies, film, everything I've done. Passion has been what has driven me and kept me going. And I can see a lot of passionate people in the room today, and I'm hoping to see that passion in your presentation this evening.
Okay, well, passion being one of this, as a culture journalist, I can attest to that passion. Now, let me introduce you to yet another judge. The Director, Health Seed AG, Sophia Aguila. I hope I said that right. Thank you so much. A round of applause for her. Okay, now before we introduce the final judge, we're expecting two more judges. I would like us to begin with our opening remarks, and I would like to call on Mr. Baluku Duna, the Senior Program Officer for AfriLab. Please, a round of applause as he comes forward. I don't know about you, but I'm ready to get into the pitches.
All right, good afternoon, everyone. Thank you, at least someone responded. Good afternoon, everyone. Yeah, my name is Baluku. I work with AfriLabs. Glad to be here. I know we've met with all the young people here who are pitching for the last couple of days, but I wanted to give a bit of information on what we're expecting, why we are even here in the first place, and what we hope to achieve. But first, allow me say a few things about AfriLabs. Can someone move the presentation, please? Yeah? Okay, I'll do it. Yes. This is what we're expecting today, but I'll just give a bit of information as we go. That's my name. And AfriLabs is a Pan-African entity. We're the largest organization of innovation hubs across Africa. What we do is bring together policymakers, investors, innovation hubs, entrepreneurs that, like these young people, to boost and drive the innovation economy of Africa. We target that at some point we hope to unlock over $1 trillion economy worth of innovation in Africa. And this is what we do every day. We have booths in about 53 countries across the continent and growing, over 500 hubs. But what is our vision? A thriving innovation economy in Africa driven by the power of our community. And our community is growing every passing day. As we support these young innovators across Africa, as we bridge the gap between investment, that's why we're working with Afrexim Bank, policy as well as entrepreneurship, we do believe that we can unlock a thriving innovation economy powered by, driven by the power of our community. But who do we work with? We support innovation hubs and their communities to raise high potential entrepreneurs, and we hope the winners here, as well as everyone else, chooses to join this massive community that drives innovation, technology adoption, and growth across Africa. We achieve this through a lot of capacity building programs. We do this as well through financing, networking. We do this through market talent, learning and development, fellowships and internships, as well as policy advocacy for the entire continent. We've been doing this for quite some time. Who do we work with? Like I said, innovation hubs, investors, academic institutions, development agencies, banks, corporates, and governments. So without too much information, allow me break down what the hackathon today is going to look like. One, we started this with about 82 applicants several weeks ago. We went through the process of selection and everything, and you're the lucky 7. And as someone mentioned yesterday, you've already won. You get to present not just your idea, but also an opportunity to showcase how you can change the health landscape across Africa, driven by the power of your talent, your idea, and the network and community around you. We're happy to report that these teams are as diverse as Africa comes. We have teams from here in Algeria. We have teams from Nigeria, of course. We have teams from Lesotho, South Africa, Kenya, and Namibia. And we hope that you come together, start networking to reinvent the healthcare landscape across Africa. And I know you will listen, and of course you'll listen to incredible ideas, but one thing is for sure, by the end of this conversation tomorrow, we'll announce top 3 teams that stand a chance to win up to $20,000 thanks to Afrexim Bank. Thank you so much, and may the best team win.
Thank you very, very much. Please, ladies and gentlemen, another round of applause. All right. Now, I can assure you of one thing. Somewhere in Africa, could be Nigeria, could be here in Algeria, could be in Egypt, there is a young girl or a young boy who is not going to survive because some of the innovation that we're going to see in this room today is not available to them. Part of the reason why we are here today is every single person in this room is part of the push that will change that statistic.
Yes, and some of these innovations and ideas that you have are geared towards building a bright future in the healthcare industry across the African continent. Now, I think we need to definitely get this moving on. But first, you're about to introduce our final judge for the evening.
Yes, I am. Ladies and gentlemen, a round of applause for Dr. Fumi Adewara, the CEO founder, Mobi Health International. All right, we have all 5 judges. Now, for those who are observing, please note that as the audience, you will have the opportunity to equally ask questions as well. So you want to listen as well so you can throw in those questions. All pitches today will be built around 3 solid themes.
And one of those things is obviously integrated patient information. I think that's something that we can all agree when you go to a hospital and getting information from patients across systems and across states and across state lines and across countries is very important. So integrated patient information.
Yes, and then we will also see pitches built around digital health and telemedicine.
And finally, affordable healthcare solutions. These are, we know that some of us don't have money in Africa. You get, some of us don't have insurance, you understand? So with the ability to have affordable healthcare, we can get our healthcare done with less or zero money. Thank you very much.
Well, I'm ready to get this started. Are we ready to see the pitches? Okay, so am I. Let's begin with the first team, Safe Access. You're up. A round of applause for Safe Access.
All right, no. Safe Access. Hold on. I want everybody to do something with me. We need energy in this room.
We do.
All right. So when we get a team, the round of applause is not going to be random. It's going to be very coordinated. Are you with me? Let's go. You can set up, by the way. Don't worry about it. It's going to be like this.
Wait.
1, 2, 3, 4.
10, 1, 10, 2, 10, 3. Dun, 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 dun.
Thank you. All right, that's the energy.
Okay?
All right, you have to build the anticipation. Are you with me? Say factors, are you ready? Can we make sure this man's microphone is working? He has been waiting a few days to speak. He has every opportunity he has had to speak to me, asking about this hackathon, he has used it. Now is your time. Are you ready?
I'm ready. Cool. You guys ready? Yeah, nice. So, can I get my presentation up, guys? Thank you. Perfect. So, hey guys, I'm Jamie from Safe Access, and we are here to save babies and protect mothers. So, a few years ago, a friend of mine, her name was Kim, young mother, mother-to-be, was a first-time pregnancy, and she was so excited to give birth. I was following the journey on social media, her posts, the little baby outfits. So I was kind of like excited for that until I saw that she actually gave birth, and I thought to myself, I need to visit her and give a little gift for her and the baby. A few days later, I saw a very strange post on Facebook. Rest in peace, Kim. I immediately messaged her sister to figure out what happened. So I knew that Kim wasn't very well off, and I asked her sister what was going on. And it turns out that she wasn't able to afford to take transport to get to the clinic, missed a couple of appointments, and without realizing it, she was actually not in a very good condition, and she sadly passed away. What I find devastating is that throughout the world, when it comes to postpartum mortalities and baby mortalities, Africa has 70% of this. 70% of all the deaths around the world for mothers and babies happens right here. Not just that, but in South Africa in particular, there's nearly 30,000 deaths per year. And these are deaths that are completely unnecessary. The main reason for these deaths is because babies and moms are not able to get to the clinics. South Africa, we know this, has state-of-the-art clinics. We do heart transplants, we do amazing work. We are such good medical practitioners there. But if you cannot get from your house to the clinic to receive these services, unfortunately, there's no hope for you. Besides the case of getting to the clinic, babies in their first year need to do about 7 vaccinations. And the clinics actually get paid by government to do these vaccinations. When someone does not show up for vaccination, the clinic cannot get that money, even though they have to have the doctor ready for that vaccination. The government loses close to 500 million per year because they miss vaccinations. What we've been able to do is look at what is the key factor to bridge this gap. And that was getting the mothers and babies to the clinics. Vaccinations are there, the healthcare is there, but the key factor is the link between the two. We thought, are there ambulances? Yes, but in the townships, even ambulances are getting robbed. What else can we use? Are there private shuttle companies like Uber and Yasser? Yes, but they're expensive for these moms. However, in South Africa and through other countries, there are ride-sharing networks, there are minibus taxis, there are public transport sectors that can integrate into the service that already dominate these streets. What we then were able to do was digitize these taxis. Via WhatsApp, we created a payment system and a booking system where we can group via the clinic passengers and mothers and babies to get safely to these clinics. This enabled a digital network where the clinics don't need any more apps, you don't need complicated services, because we know for a fact that within these networks, there is someone in that household that has WhatsApp. And there, with that, is digital support. So we are able to offer the service with low to no data usage. It's cashless, safe, and convenient, because even giving the moms cash to say, hey, go take a taxi, those moms are at risk. I know in South Africa, it's much worse than what it is in Algeria. You can't just walk around with cash in South Africa. And for a newborn baby and mom, they're high risk in that space. This also helps the clinics to plan their scheduling and plan their batches to see how they can work with these moms and babies to get them in and out as fast as possible. What we're offering and proposing is that having the clinics only pay $2.9 to us per visit to ensure that these moms and babies get there. This saves them about $86, because when they do not get to vaccinate a person on time, they don't get this money from government. in Rand, that is about 1,500 Rand that gets lost when a baby and mother is not vaccinated. So we're here to reduce medical waste, and this money can be reintroduced back into the medical system and not be wasted. This is not just an idea, guys. This is actually functional and happening. In Cape Town, we are actually moving mothers around right now. We've successfully done WhatsApp rides. When we do the WhatsApp bookings, 100% attendance takes place in the clinic. The clinics then ensure that they get their subsidy from government, they save in lives, and they reduce in vaccination waste. What we'll plan to do in year one is get 20% of the market share going through. This gives us 3.25 million in our accounts. We need about $100,000 to enable more people to know about the service and to improve our service. With your support, we can make safe access a reality for millions. The team, it's me, Dima, and our doctor. And if you want to do a live demo, you can give this a scan on your phone and you can test out the service for yourself. Let's save lives together, guys. Let's do this.
And that was done in 4 minutes, 47 seconds. A round of applause. Safe access.
You know, I can't even remember the clap I just taught you guys.
Yeah.
It's a bit complicated.
Thanks so much, guys. If you want to do the live demo, I can demonstrate how you can do the payments. I've given you guys with this code a voucher. So instead of giving cash, you'll be able to receive a voucher to pay for your trip.
Unfortunately, my mic isn't working. Otherwise, I would have told you that your pitch is done.
This is where in Nigeria they say, Senator, off your mic.
So judges, you have an additional 5 minutes now to ask. Thank you. Thank you very much. Judges, he did that in 4 minutes, 47 seconds. That gives you at least 5 minutes, 13 seconds to ask questions and for him to respond as well. Shall we begin? All right. Safe access.
Anyone of our judges going to go first? Okay.
Let's go.
Thank you. That was a very brilliant presentation. I just have a question around your revenue model and your traction till date. What's your current traction and what's your revenue model?
Sure.
Where do you see the revenue in the next 5 years?
Sure. So we currently working with 3 clinics in the Western Cape. We see a huge potential to scale. So there's 1.2 million births in South Africa per year. And if we target 20% of the market for those births, we can do with 7 visits per year per baby. That will give us at about 50 Rand, $2.9 will give us 3.25 million in revenue. From that revenue, we cover the cost for transport. We get about 80% of that money for ourselves to operate the business and scale the business. So 80%. 80% of the $2.9.
We can take another question. Your microphone.
Yes, it works. Thank you. Thank you for the brilliant pitch. So, one quick question, because you mentioned this works with cashless, right? Knowing in Africa, and I can speak of Algeria, that cashless, we are not there yet, right? In terms of the infrastructure. So, how is your solution scalable when you have a country which is not ready with the cashless?
So you guys are ready. If you give this a scan, you can literally do a cashless payment right now. This service, it's a closed loop interface. So we are compliant with Visa and the banking system. And you can literally give it a try. You'll be able to do a payment via a phone number. So if anyone wants to try it out, you scan the code. You'll be loaded up with a 10 Rand voucher at the moment. You can type in the phone number or type in the driver's code, and you'll be able to facilitate the payment. We have tried this here in Algeria. It does work here as well. So it definitely is scalable here. You can do it anywhere in the world.
Thank you, Sophia. Do we have any more questions? We have at least 3 more minutes before the time for the pitch is over. Yes, please.
Thank you very much. That was quite intelligent. But pregnancy and childbirth is a journey. It's not just an occasion. So at what point do you get the pregnant woman? Positive pregnancy tests at delivery or post-delivery? Your app doesn't tell me how. Your touch point, at what point?
Our touch point is actually
at
working.
What point?
So our touch point is working directly with the clinics and the hospitals. The hospitals and the clinics will inform the pregnant mother that this is a service to get you to and from hospital and clinics to get your appointments. The service for the patient is completely free because it is covered by the clinics, because they need to get their money from government for every vaccination. My colleague with me is an expert in menstrual health care, so I'm not sure if she would like to comment on this as well.
You do have 2 minutes, less than 2 minutes.
But the way we touch point the customers is by working directly with the hospitals and clinics. They know exactly when someone's going to give birth because they'll be giving birth at the hospital, and they will inform the mothers and not the babies, they'll inform the mothers and the mother's family that there is a service available to bring them safely to the hospital and clinic.
Also, what I also like to emphasize is that this is not just a matter of saving government money or healthcare. This is a matter of health and hygiene, human rights. We are working towards a journey where every woman can live with dignity. I'm so nervous. We are getting to a point where every woman can live with dignity, equity, and full realization of their human right. Every woman and a child, they deserve to be empowered, and every human right deserves to be protected.
Would you officially say you're done with this pitch?
If there are any more questions, do we open to the floor to the...
You still have at least 30 seconds with the judges.
One more question?
All right, thank you very much. I think that was very good. But I would quite like to understand a bit better how you intend to use the money you raise. I feel like you went past that very, very quickly. So in the 30 seconds you have, can you speak a bit more about...
Sure. So we
15.
know from the money we plan to raise, we need to create more awareness. So we need to have material, including healthcare material, that will be given to the moms. We want to upgrade the tech to the next version of the prototype. We do understand, like was asked, will this work in other countries, to better understand the government and compliance in other countries. But also, we can't just copy and paste from Cape Town to Algeria or Cape Town to Niger or anywhere. So we do need to understand the design thinking around how do other countries work, how do other clinics work, how do other patients operate. And that's what we plan to do with the cash.
All right, thank you very much. At this point in time, shall we give Safe Access a round of applause?
We have questions from the audience.
Yes.
I do know there's a gentleman over there. Can we get a microphone to the gentleman in the back over there? He has a question.
Audience, please note, you do have 5 minutes to ask your questions and you respond. Do we have any more questions? So we could take all questions at once and you could just respond to all of them.
Hello, I'd just like to ask, how does one invest in your business?
Thanks, that's a very good question. He's asking, how does one invest into our system? You can talk to us afterwards, we'll get you details, because I think if you're not just investing in us, you're investing in saving lives. Yep, you're investing in our natural resources, our mothers and our babies. Thank you so much, sir.
Anyone else with a question? Any more questions from the audience? All right, we have a question over there. Oh, okay, go ahead.
My name is Harold. Just to know a bit more about you guys. Is this your first venture or have you done other stuff before?
Hi, Harold. So we joined up for this event about 2 days ago. We're both from different areas of expertise. My expertise is in fintech and mobility, and Dima's expertise is in menstruation and female reproductive health. So we got together and realized we can actually solve something on a global scale, if not just an African scale. Yeah, thanks so much.
So that's actually the beauty of the hackathon, is that a lot of these teams were put together in a very short space of time to come up with a solution for healthcare. We have one question over there.
Thank you so much for the presentation. How do you make sure that you are able to break the myth to ensure that everybody, especially in the rural communities, are able to understand your service? Thank you.
Thank you so much for the question. We do understand that, especially in Africa, there's a lot of rural communities. What we want to focus on first is places that we can get easy access, so where there's data accessible, where there's routes accessible. One thing we know for sure is that people always need to move around. And if we can link up with the clinics, who usually, everyone knows the clinics are, and the transport services, we can get into those areas. We do also see a big boom in connectivity, fiber, Starlink, all these other things, and that's how we're going to see how we can even further engage with these mothers and families. I know you might want to add some comment to that. Sure.
Okay. in terms of technological advancement, I'm certainly sure that we all know that Africa is still a bit behind. However, with education and teaching people about our products and our system, the people can be able to gain knowledge and also be in a position to be able to utilize our resources.
I think the main advantage we have is being WhatsApp-based, which is a very widely used communication tool. With that, we're also able to change the languages to be suitable for each region and suitable for each township. So that's a very good thing that we can have. There's no complicated apps. WhatsApp is very easy to use, and that's how we can make this thing grow within the townships. A judge?
The answer is right there. Community awareness, 35%. That's just it. You're putting in a lot of energy, a lot of funds, a lot of discussions, and awareness.
That's correct. Thank you so much, Judge, for noticing that.
All right. Do we have any more questions for Safe Access? Okay. Microphone, please.
Sure. Yes. So the reason we're able to compete, you don't need another app like Uber. It's via WhatsApp, so it allows for more people to access it. The other thing is Uber is expensive, especially for new mothers. The cost when it comes to group ride sharing is that the cost is reduced by in some areas up to 18 times less using a group ride sharing service versus using an Uber. So the big competitors here is we don't have complicated apps. You don't need any more apps. The cost to be transported as a group reduces the cost. So the customers and the clients are saving money. You can by all means use an Uber, but the reason why my friend died, she did not have money for an Uber to get to the clinic.
Thank you so much.
And also the last point will be government resources are very limited and they also get robbed, mostly in rural areas. So with this app, we're also trying to reduce such occurrences. Thank you.
All right, thank you so much, Safe Access. Your time is up. I hope you've done I think you've done a really good job. It's down to the judges. Yes, let's do that.
All right. Coming up now for their own pitch would be Organo Munion. A round of applause for Organo Munion as they come forward. Just to clarify, your pitch will be for 5 minutes. The judges will question you for an additional 5, and the audience will have an opportunity to question you for an additional 5.
So 15 minutes of fame or funding. That's a good one. Someone should patent that. 15 minutes of fame or funding.
Organo Munion, you have the floor.
Thank you. Hello everyone. So I'm Filali Aziz Mohamed Al-Arbi. I'm a pharmacist and I'm here to present to you Organo Munion. So it's Africa's first integrated nutrition ecosystem. Our purpose and our mission or objective is to eradicate hidden hunger by democratizing access to supplements and nutrition in Africa. The problem we started with is a third of African children are under 5, lack of enough vitamin A, living up to 500,000 blind every year, with half not surviving beyond the 12 months. 60% of the population is vitamin deficient, and that is weakening immunity and growth. 70% of the population are facing vitamin B12 deficiency, causing fatigue, anemia, and cognitive issues. So this is not just a health problem, it's a human potential problem. Kids cannot focus on their school, adults lose productivity, and entire community face preventable illnesses. Our solution is building Africa's first nutrition ecosystem that makes good health simple, fun, and affordable for every family. At the core, we develop locally produced, evidence-based herbal and non-herbal formulation enriched with vitamins, minerals, offered in friendly galenical forms like teas, syrups, powders, and gummies that are safe, lab-tested, and accessible to all. By working with local producers, women, farmers, youth that should scale supply chain, cut costs, democratize access to essential nutrients. But access alone is not enough. So that's why we pair our solution with our product, which is a mobile app that transforms health into a daily habit. So the features of our digital solution is a smart reminders and progress tracking. Also, a gamified challenges that reward healthy routines, and a store to order our products, and a Gummy AI for bite-sized education in local languages. So this is the QR code to test our platform and the link to it. The market size landscape is characterized by two rapidly expanded sectors. The African nutraceutical market, which is valued approximately to 11.1 billion in 2024, and its projected compound annual growth rate is 9.88%. The African digital health market is valued at 3.8 billion in 2023, and it's experiencing explosive growth projected to 23 throughout 2030. Our competition is a company in South Africa, which is Vitamin Me, called Vitamin Me. It proposes premium services, and in the world we have Persona and Rituals that offers not the same concept. So our business model starts with the entry point, the quiz, where users take personalized nutrition quiz, age, lifestyle, diet, health goals. The immediate value is a free health insight awareness for deficiencies. A personalized plan product with the app that generates a custom nutrition plan with good health and well-being habits. To unlock the full plan, continue the journey, the users must purchase our products. The engagement layer, while consuming the product, users stay in the app. For progress tracking, gamified challenges, so they earn points, rewards, and badges, smart reminders, bite-sized education, and languages. So the more they use the app, the more they are nudged to stay consistent. Once their recommendation duration ends, it's 30-day or 60-day, the app triggers a retake the quiz. So refresh your plan. Your personalized recommendation may upgrade, expand the product basket. So user re-enter the cycle, keeping retention high.
And that's 5 minutes. Thank you very much, ladies and gentlemen. A round of applause for Organo Munion.
So I think, for everyone who's pitching, I think you also have to understand that being able to expressly and concisely express your idea during the pitch session is very important. It is part of the learning process. Even though you haven't finished, I think you've done an amazing job. Can we get some questions from the judges?
Yes, Sophia.
Oh, I would actually just ask you, please, could you go back to your
the link.
QR code scan, because it was very quick. Some people wanted to scan.
Yes, of course.
Thank you. Thank you. So we know the market of prevention is tricky in terms of funding, right? Even though we know it's so critical, but we have to face the reality that it is difficult to fund. I think in the business model, I was lacking a little bit like the real business model. Who's going to pay for your solution? So I think it's really the customer directly,
yes,
right?
exactly. The
out of the pocket.
Final customer, yes.
Okay, out of the pocket. Okay, so how do you intend to really keep those people who can really pay, who can really afford to pay, keep them on the long run? Because on the apps, it's really tricky. There's so many apps. So keeping really long-term adoption on the app is tricky. So what is the strategy behind for you?
So there is a progress. So you are following the progress of your health. There is So for the first quiz, your priority thing that you are solving are like the deficiency in vitamin D. So we give you a plan to cure that deficiency or to prevent that deficiency. Then in the second quiz, you have another problem to cure. So we can't solve all the problems at the same time. We have to with the first cycle, you will cure something. The second cycle, we will take another aspect, and we continue in this loop of retaking cycle, purchasing product, and following your healthcare.
Okay, DF has a question.
So, how are you different from the regular doctor? How can you determine my vitamin D levels are high or low with an app?
The object or the purpose is not to know if it is low, it's to prevent that deficiency. So from the quiz, we can take your habits, your nutrition, and your lifestyle, and based on that, our algorithm will estimate that if you have this deficiency or not, and the good habit plan and the supplements plan that you need to take to prevent this vitamin deficiency. So that's it. Yes.
Okay. We still have an additional 2 minutes. Dr. Fumi, maybe Dr. Brian, Mr. Odi, do you have any questions for Organo Munion? Okay, Mr. Brian would like to.
Yeah, I didn't get a feel for the pricing of the products. We've kind of talked a little bit today, the two presentations about affordability and that sort of thing. Now, I've since gone on the website. I can see pricing there. Can you speak at a little bit higher level about your revenue model? So is it only products, or are there other revenue streams?
The revenue streams are basically from selling our products, from our supplements. We are in early stage phase, so we have investors that we are working with, and for now we are with beta testers. So we are developing our formulas, and we are trying to sell to a small group of people. So we are not opening that for everyone.
Okay, thank you. And one follow-up question. Having spent some time with the teams, I know that this was originally conceived for the Lesotho mountainous areas of Lesotho. And so I'm curious to know, have you thought about how this would be delivered?
To how?
How would the products be delivered?
By a delivery, or we are trying to collaborate with pharmacies and stores that are near to people to take their plan. So we propose them the plan, and they go to take it from stores, from pharmacies near to them. So it's in Lesotho and in Algeria. It's a combination.
Okay, so you have distributor networks then?
Yes. Yeah.
Okay. All right. Thank you very much for that. Now we do have 5 minutes for the audience. Dr. Fumi would like to ask a question. Okay. But can we see by a show of hands any members of the audience who may want to ask questions? Okay. So we have one question at the back. Dr. Fumi, please proceed with your question.
Thank you very much for the presentation. Yeah. Have there been any clinical trials?
Yes. So I worked on that in the Pasteur Institute, and that was my study and team. So I worked on preclinical trials on exactly for vitamin D gummies. So and the results were positive. So
has that been published in any journal, local or international?
No, not yet.
So positive from your end or from an independent third party?
I did.
The results, the data from the clinical trials, has that been verified, validated by
yes, from professors in our university, the University of Pharmacy.
Okay.
Yes.
All right, thank you.
Thank you very much, Dr.
You're
Fumi. Could we get a microphone to the gentleman at the back with a question? Thank you very much. Your name and your question, please.
Thank you so much, John Maloka from South Africa. My question, I think I'm going to have 2 or 3 questions. One is, how does your program differ from the normal vaccination that is done at the schools? You know, and normally you'll find that nurses will go to schools to do vaccination to give children a bit of vitamins. As you say, that there's a hidden hunger, which the government is trying to close. How does your program differ from that? And another question is, how do you then monitor the progress in terms of the enhancement of vitamins to children and whoever might be needing it in the rural areas? Thank you.
So can you repeat the first question, please?
Yes.
The first question is, how do you differ from vaccinations?
Vaccinations?
Yes, maybe let me unpack it. In schools, especially in rural areas, nurses and clinics will go to schools, they will reach out because they know that there is this deficiency of vitamins in children.
Yes,
and
yes,
they'll reach out and to try to enhance that. How do you differ from that? And my second question is, how do you monitor the enhancement after you have executed and maybe given people your doses or whatever? How do you monitor that to say that, okay, that they are okay, that at a certain level that you want them to be? Thank you.
Okay, so for the first question, we cannot interact directly with children. So we have to educate the families, the parents, about the importance of nutrients and the importance of taking these vitamins. So in the app there is an AI companion, and we will work on campaigns of education for the importance of vitamins. For the second question, it's about
How do you monitor after you've given the vitamins and delivered them to the clients? How do you monitor the impact and how the vitamins are working on the people that you've given them?
Always there is a loop. We come back to the quiz. He'll take the quiz, and with the quiz we will evaluate. The algorithm will evaluate the next step to take in the enhancement of his vitamins or good habits of health.
All right, do we have any more questions? We have at least a minute more before we have to close this session for Organo Munion. On that note, Organo Munion completed the pitch in 14 minutes and 12 seconds. A round of applause for Organo Munion.
So I actually want to go around and ask a few questions, just to kind of have a feel of how our judges are feeling. DDF, I want to come to you first. Generally, overall, how are you feeling about the pitches so far?
Well, so far, it's been very interesting. And I don't want to call them dreamers. I love people who dare to dream. And this is what I've seen, especially with the second presentation. It's a real big dream. But I love it, dare to dream. That's it.
Awesome, awesome. I'm going to come to Odi, the man in the corner with the suit. He's been quietly asking his questions. Odi, so far, with understanding the process of the hackathon and how people were put together, how impressed are you with what the two pitches, the pitches we've seen so far, have been able to put together in the space of time that they've had?
I think that you've hit the nail on the head when you say in the space of time that they've had, right? These guys have been working for not that long, but they've been able to come up with this quality of submission. What excites me about the two pitches that I've seen so far is that, without question, if properly developed, they are potential clients of the Afreximbank Group, whether that's through our equity investment vehicle or otherwise through the bank itself. So that's what keeps me excited. These stories are not going to end here today. This is potentially just the beginning of a long-term relationship between the Afrexman group and these hackers. So I'm very excited about that.
Awesome. I think sometimes you just need to hear those words to let you know that whatever effort you're putting in, it doesn't just end here. There's also a process or a plan to take it beyond where it is, and I think you guys should be absolutely proud of yourself. That being said, we're ready to go to our next pitch. Kachi, who are we looking forward to seeing?
Please, a round of applause for Mina. There they are. Please, let's not get tired of clapping. They're coming forward to
Mina, the cool guys.
Please remember.
They look like the Blues Brothers.
You have 5 minutes to pitch. The judges will ask you questions for an additional 5 minutes, and then you will have the opportunity to receive questions from the audience for 5 minutes. Total 15 minutes. You may begin.
Perfect. So hello, everyone. Hope you're doing well. Yay, it's pizza time. So it's a wonderful moment we experience every weekend, but it's not wonderful for all of us. Many of us experience what we call diabetes. It's a disease, it's chronic disease, and with diabetes, such a wonderful moment can be transformed to, let's say, a moment of hesitation and emergency risk, you see. And this is not the case for 1, but 25 million Africans who suffer from this disease and who need a real solution that make managing their life easier. Not just for people, but also for countries. For South Africa alone, $205 million in a year were spent just to deal with emergency diabetes care. So Mina, living with diabetes, as simple as chatting. Let's first discover the features. First of all, for the patient. AI-powered food guidance, where the user can just scan the meal, and the AI will extract the data, so we see if the meal is currently good or safe for the patient. We also suggest the insulin bolus doses, so the patient ensure that the insulin is enough for them. Also, for predictive monitoring, with Mina, you can predict the future so we do not run out of energy suddenly. And yeah, if you do so, we will send an alert for you and your loved one. And also, do not forget, please, to check our yummy recipes and tips for education about diabetes, because it's chronic, so we need to educate a lot of people about it. A lot of you are waiting for me to say that Mina will replace doctor or endocrinologist, but it's not the case. We empower doctors as we empower people. So we want endocrinologists to spend more time on serious cases, more than typical cases, because in normal day of endocrinologist, 30-minute consultation is done with a client just to gather data. So we will provide data for the endocrinologist so he can send not consultations, but schedule reports with the AI. The AI will handle it in the patient side. So our values, first of all, we remove the anxiety and hesitation, and we make the patient life better. Secondly, for the patient, we prevent short-term emergencies and long-term complications, such as glaucoma and kidney disease. For the doctors, we empower doctors to make more income in less time, and this was proved by 30%. So we make the endocrinologists focus more on serious cases. Also for the government, diabetes is a big issue. A lot of money is spent just to cure the emergency and long-term complications of diabetes for the people. So we empower also government to reduce the cost and make the people more productive. Now, our business model. For patient, it will be freemium. A lot of features will be free, and some AI features will be premium for the user. For doctors, it will be subscriptions to reduce time and increase income, and for government, it will be licensing. if the government want to include Mina as in the free healthcare system, like in Algeria. Market opportunity, so the African market opportunity is quite big and interesting to invest in. And we want in the first step to invest at least in 1% of paid users so we can try our MVP. So our plan is to detail research of the market. Secondly, we collect data and do clinical research and MVP development. Now, for the time, we estimate 6 months to release the first MVP and $20K to release the first MVP in cost. And for the future vision, it's not about diabetes, but it's to make the life of all chronic disease, all people with chronic disease, easier and manageable. It was Ahmed with you. I'm the product designer and the I'm doing marketing of the team. We have Imad for the AI engineer and data analysis, and we have Ramzi for technical lead and software engineering. And before we go to the ask, I wanted to see some of the good posters we made so you can visualize kind of the idea of Mina.
Okay, all right. Mina, a round of applause for Mina. Wow, just when they got to the most important part of their entire pitch. Well, hopefully you might get to explain that with a question from the judge. Yes. Well, that's on the judges. Mr. Odi has the first question.
Yeah, I was going to say, what's your ask? I was going to give you a chance. So what is the ask?
So can you please... What's your ask?
What is the ask? What's your ask?
I want you to ask me questions.
No. Yes. So my question is, what is your ask? What do you need?
What are you asking for? How much money are you asking for?
How much money I ask for? Sorry. Yeah. It's $20K. $20K to release the first MVP. For the first MVP. Yes.
I believe this is the end of their presentation.
Oh, the ask was $20,000.
Yes.
$20,000.
Yes.
For the first MVP.
Plan? Yeah, this one?
Detailed research.
Okay.
Data collection, MVP
development.
That's $20,000.
Yes. No, that's just the overview. We have a detailed plan.
Did you get your answer?
Is it a question?
Actually, if you want to know a bit some of the details of why you are asking 20K, basically our solution is AI-based. So AI-based models needs money to run the chips that can actually handle the amount of data that we are going to be training. Especially that in healthcare we need a very high accuracy. You see, there's also some, let's say, API or software third parties we are going to be using to make the user experience seamless for our users. As well as, basically, we are going to be developing an infrastructure so it can handle, let's say, a large number of customers or, let's say, patients. So it's going to need money to serve the amount of number we are going to serve.
I think the question...
So basically, this the main 3 points we are going to...
I think the question you've answered is, why are you asking? But the answer I'm looking for is, what exactly are you looking for? And can you break that down in terms of the use? What would you be using the funds that you get for?
So how much are you looking for? And how would you use the funds that you're getting? So if you say you're asking for 20K, what are you going to, how you break down the use of that 20K? Is it?
Oh, okay. Sorry, it was kind of hard to communicate, sorry. So for the 20K, we didn't, yeah, sorry. Yeah. For the 20K, we didn't do the exact brief, but just we did the overview for now. And the brief, we need to ask experts more for a detailed briefing. I'm sorry.
Mais pour l'instant, vous avez besoin uniquement de 20K pour pouvoir développer votre MVP. Okay.
Since we have a huge...
You need your microphone. Yeah.
Since we have a huge we target big number of people. because diabetes, as we said, we have 25 million in Africa. So the 20K is
just to start locally here in Algeria,
yes,
then we can expand.
Because mostly for some rules, because as we said, as my friend said earlier, for the AI training, it takes a lot of data. And some countries have policies that doesn't allow to share data between other countries. So the process of data gathering, data analyzing, and model training, it will cost a lot of money. That's why.
So is that $20,000?
Yes.
For the data training, data collection to build your AI
Not
model?
only that, because we're gonna have a big part of it also for the marketing, since
So let me help you out so you understand. When you're pitching and you ask for money, you say you want $100,000. If you would say I want $100,000, 10,000 goes to data gathering, 20,000 goes to marketing, 15,000 goes to this goes to that. So you haven't properly broken down
We didn't do
what your 20K is for. Okay, thank you. Oh, Shah, you have a question?
Thank you very much. Very nice presentation. I think I'm struggling to understand what exactly your product is. Are you using AI to help diabetic to quantify their calories? Is that what it is? Or if it is that, then is that a proprietary application? Because there are quite a lot of AI product in the market right now, and as a matter of fact, there's a meal tracker that immediately I take a picture of my food, it can actually tell me how many calories. So I'm wondering why you would need 6 months to do an MVP in where we now have AI generating products within minutes.
Yes. So the idea is not just to calibrate meal, because that exists déjà. So the idea is to take a lot of data, physiological data that affect really diabetes, like mood, like age, like growth for children, like for gender, male or female, like daily habits. Collect all of these data and get a personalized AI assistant. Okay. So why it will take a lot of time? Because of the clinical trial, because we will recommend insulin doses. We need a lot of clinical trial to do this. And also, there is countries' policies and market research will take a lot, because the healthcare system differs from country to another in Africa. So we need to make detailed research just to start.
Thank you. That's a brilliant response. Okay, further to that, I would like to know so you're using that data to calibrate and to come up with a suggestion on the insulin treatment plan. Yeah, but is there any consideration for the role of genetics in this?
Genetics?
Yes.
Well, for now, not really. We didn't do that personalized healthcare.
Yes.
But we personalized based on the lifestyle more than the genetics. Yeah.
Okay. All right. Thank you.
Thank you so
That's
much.
very novel. Well done.
Dr. Brian?
Oh, thank you. So help me understand, again, what your revenue model looks like for this.
The revenue rule.
Yeah.
Which one?
Your revenue model, what does it look like?
Okay, so, all right, so I see that this answers the question. The second thing would encourage you to go back and look at your statistics again. So 25 million people with diabetes, there's that many in Nigeria alone. So when you consider in the US, which probably has one of the lowest diabetes rates at 10%, you've got places in the Middle East that reach 30. So if you take some number in between, around 20% of the population is diabetic in Africa. Then you can begin to put numbers to it. If there are 1.8 billion people in Africa, 10% of that is what, 180 million? So you've got a much bigger diabetic population than you're counting on. We'll go back and look at that. Yeah.
Yes, thank you.
So at this time, that leaves us with 2 minutes for any audience questions, unless the judges still want to contribute. But do we have any questions from the audience for Mina, based off of their pitch? Yes, we have one question, your name and your question, please.
Actually, could you hold on? We have a question from the judge. Yeah. You have your question?
Yeah, sure, unless there was one. I mean, this is huge market. You're touching on one of the major diseases, right? And I think this is really, I think, deserves a thorough research to my colleague just mentioning, and also understanding how is the competition already. There are lots of solutions. I think also the other judge mentioned that. So really try to understand what is your unique value proposition with the solution, because otherwise it's a bit difficult to understand how you're positioning your solution. But the market is there, the need is there, but the positioning is not very clear to me, how you're positioning the uniqueness of the solution, and then how you're going to scale this further. But the market and the need is definitely there.
Is any one of you a doctor? Doctor? Yeah. So, is this invasive? Are you going to have a patch monitoring insulin levels?
Yeah, CGM.
That is what you have not said. That is the innovation in this. Instead of pricking, for diabetes, we have to prick and check sugar levels every hour or before you eat or after you eat. They would have a chip right there comparing what you're eating to how much insulin you want.
Yeah.
That is your selling point, not any of this. So maybe I hope they'll let you just, for 1 minute, tell us.
Can we, I mean, that would have to go back to the program officer's approval. We cannot give them any additional time, and your time is officially over.
Yeah.
Also, unfortunately, we cannot take any audience questions. So thank you so much, Mina. So it is important to note that your time is 15 minutes, so you do want to get as much as you can within the time that you have. And judges, I would love to appeal to allow the audience ask their questions as well, considering that they also contribute to the points for the pitches. That being said, Amira Fertility, are you ready? Ladies and gentlemen, a round of applause for Amira Fertility. I would like to point out you have 5 minutes to pitch. Judges have 5 minutes to ask you questions and you respond. And then the audience has 5 minutes to quickly throw questions at you that you can respond to. These cumulatively influence the scores that you will get at the end of your pitch. You have the floor.
Okay. Now, imagine if you had a sister, an aunt, or even you, a person who wants to have a child. Imagine if you find yourself in a situation where you need to follow that specific calendar with colors of hope or disappointment. Now here I'm going to talk about 2 problems that we have in our African continent. So when it comes to young girls, for example, we've been taught that our periods are something to be ashamed of. So girls, young girls specifically, get their periods and they're taught that they can't talk about their sexual health or even express their problems. So my name is Samia Bunab and I'm a part of team Amira Fertility, and I'm going to present to you a story of 2 generations, 1 struggle and 1 solution. So, when silence becomes infertility. As we know, 1 in 6 women worldwide struggles with infertility, according to the World Health Organization. In Africa, infertility is often infection-related. Because of root causes such as lack of knowledge and awareness, limited access to healthcare and early diagnostics, and poor or absent follow-up care. So consequences are late treatment, preventable infertility, stigma, and silence. So introducing Amira Fertility, your life companion. Now what is our app is a first-of-its-kind digital solution. It combines an AI-powered mobile app plus innovative fertility tests. So it's more than just an app, it's a life companion for women. What it does is turning uncertainty into clarity and confidence, as well as building a digital bridge between women and healthcare. It also delivers knowledge, accuracy, and empowerment in one place. So, from testing to trusted care. Our tests are designed to solve problems such as early detection with our ultra-sensitive pregnancy tests, which are able to detect results up to 6 days earlier. We also have a kit of 5 reliable ovulation tests, which could identify fertile days with precision so that women don't miss the right moment. We can also provide instant analysis with our app, so women can manually input results into the app, and it's going to provide them with instant interpretation and clear guidance using AI. So, we also have medical follow-up, which secures transfer of results to gynecologists and enables telemedicine and faster medical solutions. So, we aim to protect fertility beyond tracking. So our app will provide you with services such as healthy living, mental and social well-being, all within confidentiality and trust. So the benefits that our app provides are avoiding treatment mistakes by missing on the day that you need to take the specific pill. It works as a better contraception support tool, and it learns patterns for accurate fertility insights. It can also have emotional benefits. Okay, so we aim to break myths and build knowledge, especially on this sensitive topic. As we know, African women have a lack of knowledge, education, especially about their bodies, and they can't actually access like treatment and healthcare, especially from this side. So we aim to scale trust across Africa by having a specific and well-studied marketing strategy. We want to build trust and visibility with a bold marketing strategy by partnering with gynecologists, nutritionists, psychologists, and women's hygiene brands to reach women wherever they are. So our growth will be fueled with authentic user stories, UGC, strong SEO, and we want to host international webinars, making Amira Fertility not just an app, but a movement for women's health across Africa.
Thank you very much. You're welcome. Thank you very, very much. And that will be all for your pitch. 5 minutes are up. Okay. Now we would like to give the judges their additional 5 minutes now. You can throw questions for Amira Fertility to respond to. 5 minutes, thank you.
Thank you for the excellent pitch. So just to understand, the solution itself is an app which is helping you to track, right? A tracking app, and there's also a test at the start,
yes.
Right?
So we have two combined solutions. We have the app, which is gonna have the follow-up and many services. So the women are going to be able to contact gynecologists, nutritionists, mental health experts, and all of this will be free. And besides that, we have two tests. We have the pregnancy test, which is innovative. It's different from classic tests, as it can predict the pregnancy like 5 days before the normal tests. And the ovulation test is a kit of 5 tests. So the woman is gonna take the test and use it during the 5 days, the 5 ovulation days that the app is gonna identify. And then she can take the data and just put it in the app, and she will know the exact moment where she should either work for, if she wants to have a baby or she wants to avoid pregnancy. So
Okay.
for both cases.
Okay, thank you. I'm actually, I was also curious to understand the business model. I don't think you touched on that. and then also understand the competitive landscape. There might be other solutions, but I'd like to leave some space for my colleagues, of course.
So one question about the innovative tests. This sounds interesting.
Yes.
Is this product, has it been developed?
Yes, we have a prototype actually, and it's under development right now. But we have a prototype, and it's been tested before, so it works.
I want to add something. The tests are manufactured here in Algeria. So with the authorization of Ministry and Health and Industry, the innovative point in this test that they are the plastic medical device is manufactured with biodegradable materials. This is the first point. Then the hormone HCG in the pregnancy test is very sensitive, only 10, according to other tests in local market or in African market, which the level of HCG, pregnancy hormone, is 25. So our pregnancy test will give the response for pregnancy 5 days before other tests. For ovulation test, other tests which are available in our local market, they detect only LH hormone, which is the ovulation LH hormone. But in our test, it's combined between estradiol and LH. Why? Because there are more than in Algeria 3 million women which are suffering from COPK. They have cysts in the ovaries, and if we use only LH, we will have false positive results.
Okay.
Because this woman,
So
yes?
we got another question, and I'm sure there are probably a couple more. So do you have a price point in mind?
Yes, of course.
And what would that be?
So for the test, the normal pregnancy test, it's around 220 dinars per one. And for the kits, for the ovulation kit, it has 5 tests, and it costs 600 dinars, so Algerian dinars.
So, and the business model? So, have you thought about the business model? Like, who's going to pay for it? Who's going to pay for the test?
So actually, we already started. So this app is under development. So it works, it's functioning, but it's not yet on Apple Store and Google Play. So we're just launching it right now, but it will be available very soon.
Who is paying? Who's the
paying
customer?
for the test? Like if I want to do it as a citizen in Algeria, I have to pay out of my pocket?
Women will go and they buy them in pharmacies.
Oh, okay, out of the pocket.
And then when they use them, they can just take a photo of the test, and then the app will interpret results, and they will be saved in the app. So their doctors can have an idea about all their cycle.
Okay. Thank you very much. We would like to give an opportunity to the audience to ask questions, considering that their questions equally contribute to this course. And of course, if there aren't any, we'll come right back to the judges. Please, we do have 2 questions. If it's okay, please, can we just take at least 1 or 2 questions from the audience?
Okay, my comment is not a question, it's to everybody presenting. I don't know how many people still have. You're supposed to, you want to win a prize. You're supposed to show your unique value proposition, 1, your business model, how you intend to spend the money that you want to get from this, and what is the time frame that you have to be able to do those. I think these are very critical things that we should let people know. Thank you.
Okay, so for the time, I'm going to start by talking about the time. So we already have an established product, and the app is currently developed. We just need to add some touches. And for the tests, we will be certifying them, like FDA and ISO accreditation, of course. And yeah, we will start the industry, and for the money we want to spend it on digital marketing and on sponsoring the product and the app, of course.
Okay, thank you very much.
My question, right? Can I?
Hi.
Yes, please.
Hi. Can I talk?
Can we have 1 second? Just want to get a question from the judge and then we'll come back to you.
Thank you. Thank you very much. Very lovely presentation. I would just like to know your unique selling point. How are you different from the product already in the market? If I hear you clearly, you said because the others measure other parameters and you are able to measure LH and FSH and the rest of them. What stops the others that are well established from copying that and exactly just getting you out of the market? That's one. Number two, what's the cost savings that you're bringing to the customer? How much is your product versus what currently exists in the market? And how are you able to sustain this if you were to scale? Thank you.
Okay, so I'm going to start talking about the app. So the app is going to be free for Algerian women and African women eventually. So the thing is, we made the tests. So the tests are the test income is gonna fund for the app. So like the app is gonna be free, but the money we earn from the tests is gonna help in the funding of the app. And as for your second question, so we plan to. We would say that it's different from other tests by predicting, because in Algeria we don't really have another brand that has the same system. So the system is quite different, and the app is going to provide free healthcare for women who don't have access to gynecologists or nutritionists or mental health specialists. And yeah, and besides that, we would like to consider our app as more of a, it's to help women. Okay. So like it's more of a humanity, on the humanity aspect.
Okay, I get that clearly. I think what I'm struggling with is understanding your business model and your revenue model. You know, when you say something is free, it's never free. Yes. Somebody is paying for it somewhere. We need to see in your business model, your business plan, how this costs. How much is the customer going to pay for it? What's your profit margin? The other features that you're giving for free, you're going to pay the doctors, you're going to pay for that. Yes. How does that come within your whole business model, your revenue model, right? And what is your profit margin after that? I think it would be nice for you, you may not have it now, to think about this, how you bring all the cost element and then look at what's your profit margin from that. But thank you.
So we're going to have to take one last question. You might not have to just think about that. We'll have one last question from the audience before we wrap this up.
In 10 seconds.
Hello. I just wanted to ask you, how much do you need? Because I didn't see it in the presentation.
What is your ask? How much do you need for the project?
In one answer, because you have 5 seconds.
How much do you need?
Honestly, we need distributors and wholesalers and partners in other African countries. It's the best opportunity.
Money.
Yes. You need money.
As a startup, we need
20K. Thank
20K.
you. That's a round of applause for them. So we would like to clarify certain things. Pitchers, please note, you have 15 minutes to pitch. Each team has used 15 minutes, and we will not be giving any exceptions. So there will not be any additional time giving if you do not keep to your 15 minutes. Additionally, in as much as the judges' responses and comments take precedence, there's also allowances for the audience, just to also give them an opportunity to further express themselves. So we'd like to appeal to the judges to please just let the audience fill in a bit of the conversation as well, considering that they might have a few questions. But in the meantime, Amira Fertility, thank you so much. A round of applause for them. That being said, judges, I noticed that sometimes when you ask your questions, you also comment, but without pitching, without giving away any information as to how you feel, what's your assessment on the last two teams? That will be Mina and Amira Fertility. Dr. Brian, I could begin with you. What do you feel, or how are you feeling about what's going on so far?
Well, I had a chance to circulate amongst the teams yesterday for about 4 hours. And was listening to them then. So I had a feel for what we were going to be hearing today. Very innovative, a lot of thought, and addressing real problems, which is what we want to see. Yeah.
All right, Sophia, any thoughts?
Yes, thanks for asking. I guess they are touching on some of the pressing challenges, which I really appreciate. And there's now this eagerness from our side to like, okay, but push them a little bit in the corner to really answer those critical still business consideration that they need to really think through, right? But voluntary, of course, we know they didn't have much time to prepare, so we are conscious about that. But really, for me, it sounds very promising.
All right, thank you very much, FD. No thoughts, no comments? Okay,
No
Dr.
comments.
Fumi.
Well, like everyone else has said, they're quite innovative solutions, so it's quite exciting to see this coming from Africa. It clearly shows that we're not bereft of innovators. But clearly, across board, I would think that there's a lot of work that needs to be done, especially in strengthening their financials. Clearly, when you look at sustainability revenue model, there's a lot of gaps there. So I think that's where having a platform like this will help them to strengthen their understanding of, I see so many of them are scared of mentioning numbers, and somebody is saying AI is very, very expensive, and it's $20,000 you're asking for. So there's clearly a need to bridge that gap and support them technically. Thank you.
So what I just heard from that entire conversation is, ask for the money. Don't be scared to ask for the money. Ladies and gentlemen, this is a pitch session. You are solving real-world problems. And some of these solutions and the ideas and the time that you put into this cost money. I think everybody focuses on just the technology and stuff. Time is also expensive. So you also have to be mindful of that when you're putting together your ask for how much you want. I've heard them ask, if you ask me, how much do I need right now? I have a few ideas. I can throw some figures out there instantly and back them up. So while you're preparing your pitches, I think just for anyone else who's working on a project in the future, I think it's absolutely important for you to understand the importance of having an ask and understanding why you're asking for what and what you're going to use it for. Without further ado, keeping it moving. Ladies and gentlemen, put your hands together for Metrace Africa. So it's not even the lady that is speaking, it's you that is speaking, and you didn't want to hoo-hoo before. Okay, carry on, my brother.
Remember, you have 5 minutes to pitch. The judges have 5 minutes for questions, and then we'll have the audience throw in a few questions. Thank you.
All right. Can you hear me? Good afternoon. My name is Derek Gaku. I'm a tech entrepreneur and a businessman. And I'm collaborating with Elvis, who is a solution architect, as well as Dr. Beverlyn, who is a digital health expert in the NCD space. So, known to all of us, or unknown to all of us, that millions of Africans in their health-seeking behavior end up in local pharmacies, chemists down the road, or the community health worker household within the village. These pharmacies or these drugstores play a very, very important role in their journey to recovery or the journey to getting better. Now, just put that in perspective. In a small village in Kakamega County, Western Kenya, baby Ivy is a 3.5-year-old. After her playful day, she feels very ill in the evening. This is within the village. So her mother, Maggie, the first thing she does is to go down the street to get some drugs to relieve the fever that is really aggressive. She describes medicine is prescribed, and she comes home and administers the medicine to the baby, puts her a wet cloth on her to just bring the fever down, and then wait for the following day so that they take the 10, 20-kilometer journey to go to a main hospital. Unbeknown to her, this will be one of the most painful and longest nights she's ever had. The baby fever doesn't get better, and she becomes extremely unwell. And by the time they wake up in the morning, she has really, really gone through so much pain. By the time they get to a hospital, it's too late. Cause of death, counterfeit, drugs. Now, I can't even imagine what was going through this little girl's body. She's fighting two things. She's fighting foreign toxins, at the same time fighting aggressive malaria. This case is not unique to her, because every year, over 500,000 Africans, according to estimates, suffer directly or indirectly as a result of our counterfeit medicines. And this is not unique to malaria. It is a problem, a supply chain problem that even affects NCDs, PPEs, and all that. And not only is it a counterfeit problem, but also a fraud problem in government facilities where drugs disappear. So what's our solution? Our solution is a digital integrated information and traceability platform that uses DS1 code to be able to verify authenticity of medicine and trace it against the value chain. We take advantage of an existing technology, which is a QR engine, to be able to enable upstream players to be able to, during importation and barcoding products, to be able to put a unique barcode and a unique QR code on the drug, and then the downstream players, like the pharmacies, to be able to verify. Even a patient can go and verify if a drug is legit or it's expired. So, how do we make money? With this product, we target the people who go through the most pain. And this is the big pharma, the drug manufacturers, and the drug importers, as well as regulators. We price the product in such a way that we charge per barcode. At the same time, downstream, we also charge micropayments on the scanned QRs from the pharmacies, as well as the patients themselves. So what is the impact? The impact is that supply chain issues are transferred to customers in terms of cost. If we make the supply chains efficient, patients can be able to pay cheaply for their drugs. It can also help promote outcomes because according to SDG 3.8, that there's a provision that patients should access safe medicine anywhere in the world. All right? This solution has the impact to transform not only local health prevention and outcomes, as well as scale it across regional, because counterfeit medicines have become a public health crisis. Thank you.
Thank you very much. Pitch done in 4 minutes, 17 seconds. Now we will give an opportunity to the judges to ask their questions. Dr. Fumi?
I'll go first. Thank you. Thank you very much. Very brilliant presentation. I know there are quite a few other applications that are doing this in terms of counterfeit medicine tracking. What's different? What's your mode? We have RX Health. We have Check It. So how is that different from what you're trying to do, and how do you intend to stay ahead of competition? Thank you.
I'll answer that question in part, then I'll also ask my colleagues to come and help me answer the questions because we're a team. But one of the things that we're bringing into this solution is the fact that we do not intend to introduce another technology hardware. So most of these preventions fail when you need a unique hardware to scan the QR, right? For us, we take advantage of existing scan feature on the cameras to help the people downstream because they're the core at it. Then secondly is to bring incentives to actually get patients scanning or sending this documentation. What we do there is what we call a reward management system, where, as an example, every time you scan, you get some redeemable points, or you're able to also,
Sorry, let me understand how your application works. You scan what? And how far in the value chain does it track the drugs? Does it track it to the manufacturers? What do you do?
So our application is a product catalog management tool that allows you to scan the upstream facilities like manufacturers and retailers to receive the consignment and receive the events data, okay? Then you go to the end user, the customer scans to look at the product master data to confirm whether the medicine is genuine or not. So the manufacturer scans to receive the consignment, but the customer scans to confirm the validity of the medicine.
Just one more. So what happens when you find out as a customer you've bought a counterfeit medicine? What happens? Do they take it back to the pharmacy? Do they get reimbursed? What happens? What's the chain of reaction?
Okay, our business model in this is we target medicine regulators, okay? This product has been used in the Republic of Rwanda to import the first consignment of the J&J COVID vaccine. So upon discovery, we provide this information to the governments in terms of data so that they can reduce their inspection budget and focus on improving their internal operational efficiency. Yep.
Yes, Dr. Brian?
A question for you. The counterfeiters are obviously they're very crafty. How do you prevent them from counterfeiting your DS1 code?
Come again, sorry?
Yeah, how do you prevent the counterfeiters from copying a valid DS1 code?
Okay, if we get into the technology part of it, what we do is the scanning is done uniquely using our application. And our partnership with the medicine regulator allows us to issue the stickers directly to the manufacturers. So only us are allowed to provide the stickers. The stickers are labeled with a unique number. They call it the Global Trade Identification Number, and other data elements specific to us. So that means if you counterfeit that data, it will not be able to authenticate. Authentication only happens if the scanning is done using our application.
Judges, we still have 2 minutes. If you would like to proceed with more questions.
What's your revenue? You said you're already in the market, right? So what was your last year's revenue? How many years of financials do you have? And what's been your revenue stream? And are you currently profit making? What's your projection for the next 5 years?
Okay, I'll just bring in my colleague.
All right, so this is the solution that has worked before. So what we're doing is white labeling it. Myself, I spend a lot of time in payments. I built a QR code engine for one of the popular payment application among the youth in Kenya. So bringing that technology into this space, combining the ideas best for the hackathon, and seeing then how do we adapt this to solve this type of problem. So in terms of just looking at the business model, the people who suffer the most pain are actually the drug manufacturers. So we're looking at a SaaS model for them to pay for every barcode that is generated by using the system, because they want to protect their market share, right? And then to just make sure that people actually scanning it, we also do micropayments based per scan. So every scan that is done at pharmacy level, at the patient level, we charge like a small percentage, like 1%, 2% of the value of that drug to just ensure that there's adaptability. And then as we continue, remember we're collecting massive data points. Now these massive data points become intelligence that can be used by regulators, that can also be used by other bodies to also track things like drug abuse, track things like drug distribution efficacy and so forth. So it's still very hypothetical, but we're able to project based on the experiences we've had before.
Thank you very much. A round of applause for Metrace Africa. At this time, if we have more questions from the audience.
We have a few. We have one at the back and one in front over there. So let's start with you at the back, gentlemen, and then we'll come to no questions.
Hello. I just would like to go back to the question that one of the judges asked in terms of the counterfeiting. So what will then happen if, let's just say there's a counterfeiter that takes one of an original product of yours, the original QR code, and then uses it in their fake products. So how would you monitor that?
All right. So that also helps us answer, the doctor's question. There's only one master database here, and the one master database is the one that Metrace is generating. So anything downstream in terms of verifiability is being verified against the master database. So unless they have infiltrated our own master database, there's no way downstream that authentication is going to bring a positive response. So there's a number of data points that we are checking downstream. We are checking the validity that this originated from our master database. Then number two, if it originated from our master database, who manufactured it, date of expiry, and all those particular details. So as long as there's one single master database, it's very difficult for them to infiltrate downstream.
So I say I'm a Nigerian, and we're very, very innovative people. And the village that I come from in Nigeria, we're extremely innovative. I'm saying if I buy a product that has your barcode that is authentic, and I scan or duplicate that particular barcode that is already validated in your system and exists, and I recreate your product, counterfeit it, and take that validated barcode and slap it on 1 million bottles. In your system, it is authentic, right? But I've now taken that authentic code and slapped it on 1 million counterfeit bottles and put them in the market. How do you counteract against that? I think that's the question everyone's asking.
Okay, allow me to answer that question technologically, okay? Any other person can generate a QR code and store data in it, all right? But when you're running a multilateral system in a state, we have a system, one system that records all the events data. Before you obtain any data and store in that system, there are two nodes communicating. So we have to have a secure handshake at a technical level. So even if you reproduce the QR and attempt to re-authenticate, we have some data elements that can only be obtained at the time of the scanning. That means you are not able to reproduce or to fake the QR.
So a QR code is, every single bottle has a unique QR code.
Yeah, there's a timestamp and it's
Okay.
unique. So
Like
yeah.
a DNA per bottle.
Yes.
And how much are you asking for to make that?
All right. So QR code engine is quite, of course, a huge percentage of our raise. We're looking at $500,000. Obviously, a huge percentage of that is going into technology. This is very sophisticated technology. So 45%, around $200, $225 just to build the core engines. Since you're doing nationwide deployment, you're also looking at cloud costs that are associated with that. And because you're also doing integrations with very critical government infrastructure, you're also looking at very secure API layer. Then 50% obviously is a lot of lobbying because the adopters of this product are also regulators, manufacturers, and whatnot. And of course, just building out the team. As you can see, the team is tech heavy. We will need to have experts in different areas of the business to finally say that we have a business model that can be sustainable. But 500K for year one is good enough.
Because to have an independent PIN or QR code for each sachet of paracetamol.
Yes, it's expensive. It's expensive tech. But now, like I said, this is...
The cost benefits.
In 30 seconds.
All right. So the good thing is that if you look at the amount of money, BBC estimated that $200 billion of fake medicines out there. So it's like cybersecurity. The big pharma, the big manufacturers are happy to pay for this because it protects market share. But then again, we're not going to do full-scale rollout. We're going to do a roadmap where we focus on a specific drug. We achieve successes with that, then we expand it out to other use cases.
All right, that being said, I think we have at least 10 more seconds. No more questions or comments? Okay.
We do have one from Odi at the end. Fumi, could you please pass your microphone?
Are
Last
actually
question.
out of time. Unless you would like to, Mr. Boyaku, shall we give them an additional because their 15 minutes are up?
No more questions.
Senior Program Officer says
Says
no more
no.
questions. My apologies. Thank you very much. Metrace Africa, well done. Thank you so much for that amazing pitch. Now we are down to the last pitch.
This
of
is the last
day.
pitch of the day.
Okay, I think we can head right in. InfoCare, if you're ready, we most definitely are. A round of applause for them as they come forward. You have 5 minutes to pitch. The judges will ask you questions for an additional 5 minutes, and we will take audience reactions and questions for 5. Your time begins now.
Okay. Hi, everyone. My name is Deborah, and with me is Sarah, and we'll be talking about InfoCare. And the plan is every medical contact tracked and every visit affordable. I don't know if you guys saw the video that went viral last week of a Nigerian woman who was heavily pregnant with twin, and then unfortunately she lost the twin pregnancy because of 2 things. First was her inability to afford 28,000 naira, which is about $20. And the second was that she was asked to go get a referral from the hospital she was in to move to a second-tier hospital and her medical records. And she lost this pregnancy. This is not a lone story. 830 pregnant women die every day in Africa. WHO actually says that 70% of the total maternal deaths happen in Africa. Not only that, mothers lose paper antenatal and vaccination cards, leading to missed visits and preventable deaths. And that results in over 500,000 deaths annually from vaccine-preventable diseases.
For our solution, we are building what I would call an extension for health data. So imagine you have a Chrome extension, or imagine your Gmail, but you're able to link that to your Google Calendar. So what we are building is an extension that can be integrated right into existing EHR platforms that then translates data into an accessible platform for patients, which they can control to be able to share their data amongst other hospitals. So let's have an overview of how it works. So we have the hospitals, labs, and then also the bank for affordable healthcare financing. So for the hospitals, the system automatically integrates into their EHR, for the labs as well. And then for the bank, we're looking to look at creating a fund, which we would do maybe like a 9 to 15% interest rate, so that patients can access immediate loan to sort out their immediate financial burdens without having to break the bank instantly. And then that would also help them to pay. We're also looking at them paying back over a 12 to 24 month period. So we're just going to do a quick demo of how the platform works on the business side. This is not sharing. Okay. So we can just proceed. Okay, so this is not sharing. Did we get an extra minute? No?
Okay, I think. Okay.
Okay. So basically, what you would do if you're a hospital, you would go on the InfoCare platform on your system. All you have to do is proceed to then install. Then the system integrates automatically into your existing EHR. Then it creates a dashboard for you to see all your cases within your existing EHR. Doctors can also access this dashboard. So for example, if a patient were to come to a doctor and they need their records, right? All they have to do is put in their phone number, which will then bring up that particular patient, because phone numbers are unique and peculiar to each patient. And then they would request for permission to access data, which patients would then allow. So also on the patient side, they have a notification screen where they can see record requests, and then they would allow a doctor to be able to access their data. So now back to our presentation. So basically what we have done, we know how difficult it can be to be able to convince hospitals to move from their existing platforms. So instead of trying to create a new EHR, we're giving them something that they can plug into what they already have that exists.
The market size is huge. There are existing EHRs, no doubt about that, but there is no centralized one bringing everybody together. And that is why by 2030, we want to onboard 10,000 health facilities and have 1 million Africans on that platform. Our business model is simple, it's a B2B2C. That means hospitals and labs pay a yearly subscription of $100. Then patients pay $1 per month, or cumulative of $10 yearly to access the InfoCare app, the F discounts, and even the credit that we were talking about. Our impact, it means that no lost records anymore. If this existed, Aisha, the lady who lost twin pregnancy, would not have died. For the doctors, it means better insight, better decisions. For the hospitals, it means cost savings. And for the government, ultimately, we're looking for real-time health insight.
All right, that's 5 minutes. Thank you so much. A round of applause for InfoCare. 5 minutes for the judges. Please proceed with your questions. Thank you very much.
Thank you very much. Very brilliant presentation, and clearly there's a market need. I don't know if you're aware, for instance, Nigeria, you're from Nigeria. What percentage of hospitals have functional EHR? So if your product is going to plug into an existing EHR, I'm just wondering, in terms of the scale, what percentage of hospitals have EHR? And then your revenue model, I see where you're going to charge the patient $1 per month, right? That comes to about $12. The whole premium, right, for health insurance is competing with this, right? Health insurance premium.
Okay.
Yeah. If the patient is going to access the InfoCare app for $12, a year is competing significantly with the cost of health insurance. Do you get my point? Because the health insurance contribution, the premium, right now, at best, is 22,000 naira a year, right? And that gives them access to everything. So I'm just wondering how you intend for what segment of patients are going to be able to pay this amount of money. Thank you.
Okay, so the reason why we spoke about it from an extension standpoint, we know that yes, there are hospitals who have EHR, but there's also a larger number who doesn't. The reason why it's an extension is because we want to be able to plug in easily to those who have, but the platform already in itself is an EHR. It should just be able to link with what exists. So this way, if I'm going to an Evercare or a Reddington, I'm not telling you, oh yeah, I have a new EHR, come plug in. I'm telling you, I have an extension I can put within your system that can communicate with other hospitals so that if you refer a patient from Reddington to Evercare Hospital, if they are all within our InfoCare ecosystem, our patients can request, the doctor from this referred hospital can request patient data, and the patient is at will to share. So we're giving that right to share their data to the patient. So that's why we're making it a B2B2C model. So from the hospital, you as a patient get onboarded on the app, and we can manage, so basically, all the hospitals that you've visited and everything and all your records within those hospitals. This would work for hospitals within the InfoCare ecosystem. So the idea is to be able to onboard all the hospitals within the system.
Thank you. I quite appreciate that. I guess now my question is, why do I need you, a middleman? If I already have an EHR and the goal is to centralize EHR, both from the government perspective and the private sector, I want to be able to open my application as a patient at home and connect with doctor in Evercare, and there's interoperability, in which case I'm able to link up with the next facility. I don't need a middleman to do that. So I'm just wondering, why will anybody else? Why can't Evercare just integrate? We have API handshake on a central level.
But then the thing is that, is Evercare willing to go integrate with every single hospital within Lagos? No. They have better work to do with their time rather than going hospital to hospital, say, oh, yes, let's have a handshake and let's share data between us. They're not going to do that. So the reason why we're building this is because we are able to develop that platform, bring everybody within the ecosystem, and put them on there and give them a centralized dashboard that they can use to share and manage patient data. Also, health is time sensitive. The time that you're spending to tell somebody, oh, please go get your medical records, you could have simply sent a request to that patient via the platform, and she could have allowed you to access her data that is in a different hospital, right, all from the InfoCare platform. So we have platforms like Google who would solve bigger problems, but there are gaps that people like us would be willing to solve to make sure that we're closing those schleps that currently exist within the fragmented system, and that's why we're building InfoCare.
How many hospitals have you onboarded?
This is a hackathon, right?
No, I just want to know how many hospitals have you?
Hackathon.
How much are you?
No, it's fine.
So, I like what you're trying to do. I just put in one or two words. First, you have to have a pilot.
Yeah.
Considering your sample size, your big N, your small n would be very, very big. I would suggest that you reduce your sample size and go back and think about how much you're really looking for. What I envisage is this will work and governments will take it over from you all.
That's our goal.
Individuals cannot pay for it. Health insurance will probably pay. Governments who want to be correct socially and health-wise would jump on this. But you have a lot of work to do. It's sustainable, it's doable, but you're ambitious, I won't lie. And you always verify your stories. I wasn't going to refer to this, but you said it twice. The woman in Abuja had lost her babies 2 days before she decided to show up in the hospital because she wasn't feeling fetal movement. She was praying and hoping. that the babies would somehow, and the 28,000 was to treat the infection she had acquired. Delivery is free. And secondly, if you superimpose that on this, we all think maternal mortality is all about government not doing enough. The pregnant woman has a lot to learn. Yeah. The pregnant woman has to be convinced how this can save his or her life. I have heard a lot about maternal mortality, but we're all pointing hands at the government and the banking institutions and the development agencies. The woman herself has a lot to learn, mindset to change, and together we really can crush maternal mortality. Thank you.
Thank you very much for that clarification as well, because we know how viral that story went. So I think it was very important that we put some context into what that particular story was about. Also, if anybody was going to come across it, that is the real story. But in the meantime, I would like to ask the audience, you have at least, give or take 3 minutes. If we have audience reactions, we do have one question at the back, and we have a second one over here. So shall we begin? Your name and what your question is. Thank you very much.
Thank you, ma'am. I think this is a brilliant idea. However, how do we then convince patients that their information is safe? Because remember, we are dealing with confidential information. And how do you then make sure that they can buy into the concept and run with it? Thank you.
Okay, so when I was walking through the demo, right? So while we have InfoCare, the idea of InfoCare is not to just have people's data for anybody to just access. Even if you were a doctor in another hospital that the patient is going to, you cannot access that data without the patient's consent. So the first thing that you would do on the InfoCare when you have a patient who is coming from an ecosystem hospital is to search for their phone number, which would then bring up a profile, and then you request for access to their data, which they would then allow from their devices, either via SMS or the mobile app, which will then unlock that access for you to review their data. So in terms of protecting people's data, we don't intend to just have people's data within the platform exposed to anybody, right? So we've made sure to put a layer for verification before anybody can just access anybody's data. And then in terms of convincing the patients, your life is at risk. You have basically a very small window. There's a lot that can happen within the platform. If you go somewhere and you have 30 minutes to leave, and I'm telling you, you need to go to somewhere around the airport to bring your medical records before I can administer any medication, you don't have enough time to leave because you can go get stuck in traffic. But if you had the InfoCare, all you needed to do was grant access, and they can see all your medical records via the platform, which makes that time constraint. You can have a chance to leave with just this platform. So yeah.
All right.
Okay, we have 30 more seconds, so real quick, please. Thank you.
Okay, so my question is this. In case where a patient has an emergency and is, say, very unconscious, so how does the patient get to give consent for the doctor or whoever to get access to their...
Okay, I believe we all have guardians and next of kin, right? So if you're onboarding, you would have to put a next of kin. So if in a case where you're not able to, maybe due to the fact that the patient is critical, the doctor would have to be able to send a request to their next of kin.
All right, thank you so much.
So that they can grant access to their records.
A round of applause, InfoCare, ladies and gentlemen. Thank you so much for your time.
Yes, we have come to the end of our pitch sessions. I had a question, but I just realized that if I asked the question, that means they would have had an opportunity to pitch some more and explain what they're trying to. It won't be fair, because that EHR is something I think is very important in Africa, and that solution makes a lot of sense. How are judges feeling, DDF?
I think we should give the judges an opportunity.
How are you feeling?
Yes.
Today?
I'm trying not to be a doctor. I'm just trying to be objective out here. The gentleman that asked about an unconscious patient, what if we met an unconscious patient on the street or somebody drops him in the hospital? We would have to treat him with or without his consent. So at times in Nigeria, well, in Africa, we try and look for roadblocks and we catastrophize, like, what if this happens? What if that happens? But we have to weigh the benefits of this solution against the, my patient records going public. There's GoFundMe. People put all sorts of things just to get their lives saved. I'm feeling good, especially about this last one, and I think it's something that is very much needed in Africa and especially in Nigeria. Thank you.
Thank you so much. Thank you, Sophia. How are you feeling, Sophia Aguila? How are you feeling?
I mean, good. It's inspiring to see all this energy and this creativity. And you know, I think those pitches overall show the resilience that we have in Africa. Like, go and try to find solution, even if the system is fragmented. And yes, there are gaps. So they're trying to fit, those gaps with really adequate solutions. So I'm really, really impressed by this.
You know, Dr. Brian, I noticed you were on your computer a lot. You were typing, you were writing, you were doing a lot of thinking during this session as well. What are your thoughts looking at all the different pitches we've had today and the future for healthcare in Africa?
Yeah, we've got a great young generation of innovators and thinkers. Some of it needs a little guidance here or there, but what we heard today all have application, all have potential, and very, very pleased with what I saw. And in fact, there was a dramatic improvement today over a couple of them that I saw yesterday. So congratulations to each of the teams. They did so well in preparing their presentations today. Yeah.
Dr. Deora?
Alyssa, help with the microphone, please.
Yes, I echo the same sentiment. I think they're very brilliant, qualitative, very quality presentations and innovations, quite different from what we see generally. So I think they've put in a lot of work and effort given the very short time frame. So yeah, I'm looking forward to just seeing who the winners are, regardless of who wins anyway. It's a lot coming out here. So you should, whether you win or not, I think the ecosystem here will support them in nurturing their innovation.
You know, Dr. Doherty, I'd like to bring you into this conversation, but just before I do, it's important to note that for Professor, thank you very much for that correction. It's important to note for the guests who are with us today, the innovators, the founders, the first prize for this hackathon is $10,000. The second prize is $6,000, and the third prize is $4,000. Now we had 6 different pitches. What?
Outside the ask.
Oh yes, that's just what it is. I think Mr. Audi would provide more clarity on that. She's asking the money is it outside the ask?
Completely outside the ask. Completely outside the ask. Yeah. For their efforts.
For the records.
This is just award for the winner. That's all you are saying.
Precisely. So this is to encourage you to understand that you are not just seen, but there is support here, and there's an opportunity to be heard. Professor, your thoughts on this? Healthcare within Africa. We've seen the pitches speak across integrated patient information, digital health and telemedicine, and affordable healthcare. 7 different, groups with unique pitches and unique ideas. How important would you say what we're doing here at this hackathon is?
Well, I think it's perhaps the most important part of the Intra-Africa Trade Fair 2025. I have said in several forums that allowing the youths, startups, SMEs to be able to project themselves, their business, their innovation is what the IATF is really all about. It's not for the big conglomerates of this world. It's for these young ones with their bright ideas. It's for us creating that platform where they can connect with much needed capital network experience from, the judges that are here to be able to scale their business. So I have been very, very, very delighted that we had a good session. The only thing I, was sad about was that I missed a big part of it. I hope it was recorded and I can, just go through the video clips of everything that went on. But I am happy that this event has gone on smoothly. I am, and the tail end I caught, which was the InfoCare. I think the presentation I saw towards the end was very good. And I do hope that we can get some people who would be willing to at least fund them and help them scale. And that will be one of the things that my team would be trying to work with the winners on. Apart from the prizes we are giving them, we will also be trying to help and hold them to see that at least we can connect them to, investors that could look at their pitch and see how they can help them scale. Thank you.
Thank you very much, Professor. Thank you.
All right, so at this junction, excuse me. At this junction, I want to say, thank you to everyone. I think it's important to commend every single one of our hackathon competitors that came up today, starting with Safe Access, Organo Munion, Mina, Amira Fertility, Metrace, and InfoCare. And at this junction, we'd like to come on to call on stage Mr. Odi Akanowa to the stage to come and give us his closing remarks and how he feels. I thought you were going to use your long leg to climb up on this side.
This is such an important part of the event because Mr. Odi is the director for the SME development, and there has been a lot of sessions with pitches for various types of business, but this specifically for healthcare.
Thank you, Master of Ceremony. Thank you, everyone, for coming today to the inaugural IATF Healthcare Hackathon. If there's one thing I'm very sure of, it's something that we're going to keep doing going forward, because just on the strength of the quality of what we've seen today, I think we'll be missing a huge opportunity by not giving young innovators on the African continent a chance to come and share their ideas. I mean, it's glaring, it's obvious. Africa has a huge healthcare deficit, and nobody's going to come and fix it for us, So we can either cry about it, or we can tap into the reality of the fact that Africa has the biggest youth demographic in the world, and there's a demographic dividend to be gained by giving young people a chance to help us to innovate. Today I saw African solutions to African problems, which again is what this platform is about. There will be 3 winners, but as has already been said today, it really is not about that. I think each one of the pitches that we've heard today is a potential partner, customer, client of Afrexim Bank. So regardless of what the outcomes today are, I personally am looking forward to working with each and every one of the 7 contestants that pitched. So on that basis, good luck to everyone, and I look forward to seeing you tomorrow. Thank you.
Wow. Professor Doherty, at this point, would you please join us on stage as you give the official vote of thanks to wrap up the first ever hackathon? I'm excited. The first ever hackathon. I'm looking forward to the second, the third. This was really interesting.
I'm actually looking forward to competing in a few myself.
At this point.
So I just want to thank all the participants who participated during the Health Hackathon, and also our esteemed panel of judges. And I don't know whether we had accurate timekeepers, but if we did, we did. And the accurate timekeepers. So we thank you. Please, a round of applause for our judges. It's not easy to judge you. Judging is one of the most difficult jobs you can ever give anyone in this world, but they took it upon themselves and did it very calmly. And like Odi has said, this is something we'll be taking forward. More importantly, because we know health is wealth. I think we've underplayed the value, the role of healthcare on the continent and to us as a people. But COVID-19 pandemic brought it out clear in our face, where if we don't safeguard the health security of the continent, we are putting all our lives at risk. There's nothing like trade, commerce, economics, when you don't have health. So health is wealth. It should be top on all our agendas. And at Afreximbank, we've prioritized healthcare. We have an health and medical tourism program that the bank launched since 2012. And my division has been tasked to advance it in all its ramifications. And one of the things we've struggled with in the past is how to bring it closer to the youth, the SMEs, the women-led businesses. And with Odi's department, the SME development team, we've been able to craft, some innovative programs, capacity building interventions, and financing to scale health. One of the good things I'm so happy about is that when we launched the Africa Medical Center of Excellence in June this year, we signed an agreement with Bank of Industry Nigeria to finance local manufacturing in the country, within the pharma and health space. And I'm happy that as today, Odi's team are almost finalizing the credit approvals to be able to disburse that financing. And how many health care companies are going to benefit from that? Over 20, right? 34. So you see that impact in terms of boosting local manufacturing within the healthcare space. And then the hackathon, which is directly addressing youth innovators, startups, within the health digital space, almost like a fusion of, health, IT, digital, So it's also something that we said to ourselves we needed to put focus on. And no better place than the IATF to be able to bring this to the continental stage. And this is the first hackathon, but I will invite all of you to join us in 2027 for the second edition of the hackathon, which will be bigger, and we would also try to ensure we get in more partners to help us scale this. I'll be looking to Mobi Health and other partners to join Afreximbank, and even ANC at that time, to scale this on a bigger, dimension, and to create more opportunities for even more youth-led businesses, innovators, startups on the continent to participate. So I know we said we looked at 7 finalists, but next time we must double this to 14 finalists and to have prizes for the first 5. So Odi, that's the challenge. But another thing I don't want us to let go of and forget, you have made a commitment here that you will work with every one of these finalists. I don't want us to drop that ball, please. In every way we can support them, let us work with them. And if there's anything, I always have your back. As long as it's healthcare, I will support it. So let's work with them to be able to ensure we don't let go of them just after this whole exercise. So I thank you all for participating and look forward to seeing you at IATF 2027 in Lagos, Nigeria. Thank you.
Thank you very much, Professor Doherty. And with that being said, we would like to thank you all for being such a gracious audience to our judges.
Such a gracious audience.
Thank you so much for your insight, for your knowledge.
Insights and knowledge.
For your very careful critic as well.
Careful criticism.
We truly appreciate it, and a big congratulations to all the pitchers. My name is Kachi Ofia, and
Her name is Kachi Ofia.
I have been one part of your host and moderator for this hackathon.
And my name is Dr. Seed. You have to say the doctor twice because I'm like James Bond. Oh, you just clicked at me. I'm getting you. It's an honor to be here. Healthcare is a very important part of who I am as an individual. It's actually tattooed on my body. But ladies and gentlemen, we're happy to be here. Look forward to seeing you too, and all the best to all the contestants.
All the best.
We will see you tomorrow. Have a good day.
Have
and
a good day. Thank you very much.
The rest of IATF 25. Can we have all the judges on stage for a quick group photo, please? And the participants should please stay because we're going to take a group photo as well.
Higher grounds we're lifting up, nothing holds us bound. Can you see it? The light of Africa is rising to higher grounds we're lifting up, nothing holds us bound. So come on and come on, we call on, oh Africa, come let us build a dream for all. Together we grow stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines that separate, and shine a light on the things that make us great. We're stepping forward, we're rising up. Oh Africa, our time is now. Oh, 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 yeah. We know we got that power. Africa, we are strong. One nation to another. See now we stand as one to celebrate our victory, riches and glory of the motherland, and nothing holds us bound. So come on and come on, we call on, oh Africa, come let us build a dream for stronger and united. Paint out the sky with the bright colors of your flags and say goodbye to the darkness of the past. We're stepping forward, we're rising up. Oh Africa, our time is now. Break down the chains, clear the lines